practitioners and certainly the pharmacists. And so delighted that Chamarajanagar is going to be one of our pilots in moving this idea further. So very good.
Great. So DTO team and SETI team, I attend meetings after meetings throughout the day. And when the time comes for the actual meeting, I generally keep looking for the link. So it will be a good idea if you can share the link right now once again to all our invitees, special guests, and also in the groups, because there will be many people like me, who would be searching for the link. So if you share with them right now, it will help them. And this is specifically for the special invitees, Dr. Ravi.
Yes, sir. Yes, sir.
Good evening, Dr. Chadya. This is Devlina here. Good evening, ma'am. I couldn't get to you.
No, I'm all here now. Thank you so much.
Thank you, ma'am. Thank you for your presence.
And Dr. Manoj, Mr. Vishwanath from Ashray Hasta Trust is also here. He's presenting, he's a donor, and he's, AHT is well represented. He's also present.
Okay, great. So
very good evening, Manoj sir.
Hi, thank you so much, and good morning from USA. And good evening to all of you. And we want to be very thankful to folks at Asha Hasta Trust, and certainly Asha Dinesh and K Dinesh, who are co-founders. K Dinesh is, as many of you may know, being also from Karnataka, is a co-founder of Infosys. He is a close friend, and we have been working together for over 15 years on quality improvement. And also he has been a great advisor to SETI on so many topics of tuberculosis. So very close ties to K Dinesh, Infosys, a co-founder, and we are thankful to his foundation and Asha Ji's foundation, Asha Hasta Trust, which is doing incredible number of projects in all over the world, in fact, and great deal of work in mental health as well. So thank you to Asha Hasta Trust for their warm contribution and to be with us in this venture and to make it happen.
Thank you for the introduction, Manoj ji, about AHT especially. And again, mostly I'm expecting Dinesh sir to be joining this meeting. Mostly he may join.
Great. It will be wonderful if he joins.
Ram sir, I think DC sir has joined. I could see someone with the name.
Okay. Ramesh ji, have you joined?
Yeah, I'm here. I have joined.
How are you, sir?
Good evening. Yeah, good evening, everyone, especially entire city team. And the doctors, practitioners, those who have participated.
Good evening, sir.
Yeah, good evening.
Okay, in that case, I think Dr. Ravi, since the, Deputy High Commissioner is already here, I think we can start the proceedings. Not good thing to hold people waiting. Okay, so I'll slowly. I will slowly start the momentum. Okay, so that we can hear, because definitely we are in a predicament right now. We want everybody to hear the district magistrate also. So we are waiting for the people to log in, and every moment 2-3 people are logging in. We already have 66 people, Ramesh ji, from the private practitioners as well as the pharma. So good evening to you, ladies and gentlemen, and good morning to you, Dr. Manoj, who has logged in from the United States of America on this wonderful day. And I would like to begin the proceedings with gratitude. I would like to express the gratitude of SETI. SETI is, a collaboration to eliminate tuberculosis among Indians, to the central government, that is the Central TB Division, to WHO, to our State Tuberculosis Officer, to Emory University, to Association of American Physicians of Indian origin, for encouraging us and inspiring us. Special thanks to Ashray Hasta Trust, who are our donors, who are Karnataka-based, represented by Mrs. Asha Dinesh, and Mr. K. Dinesh, who is also the co-founder of Infosys, and he resides in Karnataka, and he has special feelings for both Mysore and Chamarajanagar, and that's why we have started the project from these two pilot things. My gratitude to you, Ramesh ji, Deputy High Commissioner, and the District Magistrate, to the CEO, to the DHO, to Dr. Shazia, WHO Consultant, to the President of IMA, who will be joining shortly, to the Assistant Drug Controller, who will be joining shortly. So that is how I wanted to start, because our objective was to bring, Brahma, Vishnu, Mahesh, Devraj, Indra, everybody together, so that, we can fight this TB disease together. And today's day is a very historic, very, to be written in golden letters. You must know where we come from. Very briefly, this is who I was 30 years ago. I retired as a naval officer. Commodore, I have been at naval operations. Not much about myself, but I have enough experience and more in national and international affairs at levels. And now I am a transformation leader. But that is not so important. What is important is I am part of your DTO's team. That is more important. Our co-founder, Dr. Salil Bhargav, he is head of department pulmonary physician at MGM Medical College. He's a co-founder of SETI. He's a participant at WHO Joint Monitoring Mission, chairman of RNTCP Zonal Task Force. This is to let you know that we are a bunch of professionals who have brought our own experience to the TB world. Dr. Manoj Jain has joined us. Dr. Salil, if he is there, let me know, please, some QIC. Dr. Manoj is an infectious disease physician. He is also a faculty at Emory University, Rollins School of Public Health. He is the co-founder of SETI. He is a topic lead at WHO Joint Monitoring Mission in November 2019. And more than that, this is what describes Dr. Manoj. Dr. Manoj, I have to, so that people listen to us. They know what has joined the DTO's team, what has joined Chamarajanagar. So Dr. Manoj is a contributing writer to the Washington Post. He has got projects running under US aid grant. He practices nonviolence, and he's a propagator for the same. He is a healthcare quality improvement professional. He has written many books on Jain food, Joint Path. He is educated at the Boston University and the Harvard School of Public Health. And he is also currently at the Rollins School of Public Health, and also represent the University Tennis Health Science Center. So I will just make a brief statement, Dr. Jain, about our objectives. Then I'll request you to add on to the objective, and then we will have the sequence going. And if somebody can let me know if Dr. Anil has joined. So what is the objective today? Is there anybody for whom we may be talking very fast? I am sorry, I don't know your language. I will try and learn it very soon. But if you feel that we are very fast, do let us know. The nation, the state, and the district needs your support. I'm addressing the private practitioners. I'm addressing all the pharmacists who have joined us. And we are going to prove that this will not be a one-way traffic. This will be a mutual benefiting journey. We will make sure that we clear all the misunderstandings, cobwebs, gaps that may exist in the understanding of the TB program, so that each time you notify a patient, you find it materially interesting, spiritually satisfying. It brings you recognition, it brings you growth, and you find a lot of benefit, personal, professional in doing that. And that is my objective that we will do by the end of this session, so that we start a chain reaction in Chamarajanagar. And I am very proud to share with you that this is the pilot project which is running first time in the country, and our success will define its acceptance in the entire country. And we are confident because we have huge amount of experience in the nation. We are personally in connect with about 550 district tuberculosis officers across the country in the districts, 1-to-1. They know us. And that is how we came to know with Dr. Ravi also. So with this, I will not waste time. I invite Dr. Jain to share his vision, and then we move ahead.
Namaste, and Ramanji, thank you so much, Commodore Raman. Mr. Ramesh, wonderful meeting you. Dr. Ravi, so nice to meet you last month. I was in Chamarajanagar meeting and talking and addressing so many of the issues that we are dealing with in the area of TB. So I want to welcome especially the private doctors, private practitioners. And I want to begin by saying, I am a private practitioner. For 30 years, I have been practicing infectious disease. I have been seeing patients with tuberculosis. I have been seeing patients with internal medicine. Yes, I have a faculty appointment at Emory and others, but I am at heart and day to day, still today, see patients in my private practice. But I want to tell my private practitioner colleagues here कि आपको कोई fear नहीं करना है कि हम आपके competition में आएंगे, और मुझे भी ये fear नहीं करना है. I don't want to be fearful that you will compete with me, because we are about 9,068 miles apart. So yes, there are enough patients in US and enough patients in India for all of the private practitioners that are there. So being here, one of the things that I have seen in my journey is that the ability to eliminate, to reduce the tuberculosis load is entirely possible. And it is possible because doctors like you and me are able to recognize TB early. If I were to say the single most important thing, क्या सबसे जरूरी चीज है जो private practitioners करता है, even in the US, I work with hundreds of doctors, and the single most important conversation I have is, could this be tuberculosis? Anyone who comes with a slight fever that is going on for a couple of weeks, someone who's having a little bit of weight loss, the first thing in the back of my mind that has to come in the front of my mind is that, could this be tuberculosis? And then to do the right test. As private practitioners and chemists and others, this is how we eliminate, because early identification allows to reduce the gap of transmission. That is the most critical part, if we can reduce that time frame for transmission. So I come to you as a fellow colleague, someone who is from India. Yes, it has been 50 years that I have left India, but each year I am there, once, twice, last year, 3 times, have been in your district many a times, have close family and friends in India and in Bangalore and in Chamarajanagar, where many of my friends' family ancestry comes from. And that is why we are there and to work with you. We believe that if we work together, we can show a model for the world that we can eliminate TB in Chamarajanagar. And we cannot do this without the doctors, without the private practitioners. Without Mr. Ramesh and his entire district team, without Dr. Ravi, without Dr. Anil, without so many of you who are here, Dr. Shazia, all of you are critical to make this happen. So I pause with that, and I want to thank you. And thank you so, so much for being here with us to make this entirely possible.
Thank you so much, Dr. Manoj. I could sense the emotion in your speech, and it makes me overwhelmed as well, because this is the passion that we share, and that is how it comes forth. And so with this, I very warmly and with a lot of affection and respect in my heart invite Mr. Ramesh DS, the Deputy Commissioner and the District Magistrate of Chamarajanagar. Mr. Ramesh, it was such a pleasure meeting you. It was so inspiring when we met you, and you encouraged us so much in one meeting itself. And we promised you that we will make you, your team, very strong. And so today is the first day. May I request you for your views, your vision, and what would you like to share with the private practitioners and the pharmacists of Chamarajanagar? Sir. Okay, I think he was there. He's just.
He might be on mute.
Sir, you're on mute, sir.
He's on mute. He's on mute. Yeah, sir, if you yeah.
Yes. I think it is unmuted. Is it audible?
Yes,
yes,
audible.
audible.
Yeah. So sorry for that. So good evening once again, everyone, those who have participated in this conference, especially for Raman and Manoj Jain, for the entire team of a city. I think so. We were also doing, in fact. So before you come over there, I think already we have discussed in the district with your team. So we also started thinking of, why can't we eliminate and become a model for the entire nation, especially as far as the TB elimination is concerned. 2 rounds of discussions we had in the meantime. So you have also joined hands with us. I think I am so grateful, in fact. So the initiatives which you have shown to the district for contributing your experience and knowledge and other things, for especially to achieve the vision of our Prime Minister, that is TB free, that is Mukt Bharat, TB Mukt Bharat by 2025. I think so the private practitioners and also pharmaceutical institutions, those who are there in the conference, I think definitely, I think it is not an individual effort, as you said rightly. We all need to collectively work for this, and we are a TT as a district administration, so we fully support even the private practitioner at any point of time, any requirement, any intervention from the district administration, even in respect of the pharmaceuticals. We are with you, and probably collectively, if you work together, definitely we can become a model to the nation. So I think this is our great motto, and this is only the objective for which we are all working. I think our Dr. Ravi will be with you at any point of time, anything. But what has happened, I think you will be very well aware that. So there are rules and regulations which also needs to be, I think that awareness needs to be created among the fraternity to see that in the Nikshaya portal is there. So proper registration needs to be done and the proper follow-up needs to be done. Of course, the tracking of this is being done periodically from us, but the practitioners, those who are there in the Chamarajanagar, and the pharmaceuticals, those who are there, I think they need to get up for this occasion. And if they mind, I think definitely we can do wonder in the district. And my ambition is to see that Chamarajanagar stands first in elimination of a TB, as per our Honorable Prime Minister vision, to eliminate TB in India by 2025. I think I hope probably all will fight for this, and will show what Chamarajanagar is. And this is what I wanted to convey. In the days to come, I think we also, probably physically also will meet sometime in my office. I think I will request my DTO Ravi to call one more meeting physically. Is there any hurdles? Is there any support? Is there any coordination which is required from the district administration? So we are ready to do it. Okay. So then I think, so we'll do, and we'll take up, and we want this, in fact, to make Chamarajanagar free from TB.
Thank you. Thank you so much, Rameshji. Thank you so much for the kind words. And we would be now increasing, as we discussed in your office, increase the scope, the frequency of the TB forum, and we'll change the format also. So we look forward to that, and we'll bring the contribution by our private practitioners. We'll recognize them, we'll acknowledge them in the TB forum. So nice of you, sir, for your time and for the kind words. Dr. Manoj, would you like to add something?
No, I think your leadership, Mr. Ramesh, is so critically important. What we find is that we can have technical expertise best in the world, but if leadership is not there with us at the technical level, things do not happen. So that is so critically important. And thank you so, so much. And you have articulated the vision, the mission, both from the Prime Minister's angle to at the collector district level angle, and cannot thank you enough. And at your level, you are working at the TB forum to make things happen. And Dr. Ravi is working at the district level to make things happen. And then certainly at the Gram Panchayat, we will see some of that. And the practitioners who are here and their offices will make things happen.
So great. And, the phone call which I had not muted was from the STO of Karnataka. He is joining us soon. But I know that Ms. Puvita, she is the Chief Executive Officer, Zilla Panchayat. She's here with us. Ma'am, can I hear a hi from you? You're on mute, ma'am. You're on mute.
Hi.
Hello. Well, and so nice to be here. I had the good fortune of meeting your predecessor. I understand you are just some days old in your office. And it was a wonderful meeting that we had with her. And there is a special purpose, ma'am, that you are part of this meeting, because next milestone, we are focusing at the village level. And we will start eliminating TB from the village level, coming to the block, then move up to the district. So we are focusing on 3 TUs specifically, which Dr. Ravi, in his meetings and in his briefings to you, he will update you. But as of now, it is our good fortune that you are there with us. May I request you to share your view about today's session? Yeah.
Thank you, Mr. Raman Arora. And thanks to the team of SETI that such a meeting has been organized. Only one request. This is not my photo, so I request you to remove the photograph. So yes, why this meeting is unique? Because it has brought SETI, the district administration, and the private practitioners also, who are an important part of this TB eradication program. Without their help, we will not be able to achieve this 100%. So we have been having a discussion with TB officer in Zilla Panchayat since yesterday. I was going through the data of presumptive testing and the rate of identification, the NAT tests that are happening, and this rate, and they're not evaluated. We were able to identify few areas which we'll have to focus on, so that like we'll be able to improve our success rate from 87%, 80+% to 90-95%. So one area is the presumptive testing. So from the government side, we will have to increase the number of presumptive testing, for which with the discussion with Ravi, we have decided to improve our tracing, not just to the family members, but also to the workplace where the person who has been tested positive has been working in close proximity. And from the private practitioner side, we would request you to improve the referral so that we will not miss out even a single patient who could be a susceptible TB patient. And then we have been having a discussion that we should have data from the district drug controller also, data from every chemist, whoever is selling the TB medicines, whether those patients are already enlisted and notified in our website. If not, we will have to notify them and bring them into our surveillance radar. And while we were discussing this, we got to know that there is so much of stigma in coming to the hospital for testing also, and even revealing the fact that they might be a TB patient, which makes even the prevention also difficult. So we have discussed about improving the IEC materials at Gram Panchayati level also, so that the people who have the symptoms at least go till the PHC level to get themselves tested. And next one, we had this year 87 deaths in 2022. So probably next week I'll have a case-wise discussion of why these deaths have happened, and we wanted to segregate the avoidable deaths so that the death rate will go less. And then the success rate also, while we were discussing, Dr. Ravi was saying that we will have to increase the patient-friendly environment in the, and we have a not that is who have given treatment in between, in which even system failures are also part of. So as of now, Mr. Raman was also discussing, even we are preparing GP level TB patients so that we will be able to have a regular follow-up of them. We will be able to bring the Gram Panchayati task force and the entire Panchayati administration also into active TB eradication program. So I would like to meet a SETI team also in the future so that we can have a discussion to how to take it forward. Thank you for the entire team. So under the leadership of our DC sir, we will be able to take this up forward with 100% support from the Gram Panchayatis. Thank you.
Thank you. Thank you so much, Savita. And my apologies for the wrong photograph, because in fact, I was also wondering, you look so graceful and much brighter than what I had shown in the photo. I apologize on behalf of my team, and the error is hugely regretted. I will make it a point to meet you. And in fact, I would be in Bangalore on 22nd, and I'll be there for 3-4 days. So if our times match, it'll be great if you can offer me a cup of coffee, and in 15 minutes I'll update you. To begin with, ma'am, we will be focusing on Gunglupet, Kollegal, and Chamarajanagar headquarters. So these executive officers, under you, we would like to brief them what is our objective. And you very rightly mentioned about the stigma. Very recently, we were very fortunate that Shri Ravi Shankar, Gurudev himself, he was part of our session, and he is hugely supportive of our work. And he has reached out to the country, and we'll be sharing those clippings because, when people or spiritual leaders talk, probably the reach is more, and it affects people more than, what you and me can probably do. So we'll be sharing those clips as well with you. And there is another thing, probably I'm asking more, but then, it's my privilege that you are there, Sakshat, so I should not miss the opportunity. The TB champions, people who have, fought the challenge and have become okay. They are the ones who are from the humble background. They don't come forward, but their children can. They are digitally sound and they can tell the stories. It's easier to convince them that, the disease is nothing big. It's curable. It's nothing to hide. So we would need the cooperation there at the village level. These are the few, targets and asks from the executive officers, and we'll meet them. We'll meet you. We'll share our passion with you. And Dr. Jain, may I request you to say a few words for?
Absolutely. Ms. Puvita, you've really done a root cause depth analysis of issues and challenges behind why we are not able to achieve TB-free. And it is great that we have been able to do that. Now the next step is, how do we approach? And we have a process called PDSA, Plan, Do, Steady, Act, methodical process. So I will say that is which Dr. Ravi and his team know very well, and they'll be utilizing that. It is an international process in which business, others do the same thing. Toyota became very famous, Federal Express likewise, for bringing quality using those processes. So say what that statement. The other one, all our private practitioners are here. They are the encatchment area from the rural village area as well. And WHO has come out with a very clear guidelines on TB-free panchayats. We would love to have more and more villages and areas from our district to become TB-free. And those are very clear guidelines, and will be the first. It has barely, it's coming out in the next 2 to 4 weeks. So we're ahead of the curve, and we actually got the pre-copy of that. So we'll share that with you.
Thank you. Thank you, Dr. Jain. Thank you so much. And with this, I would now like to invite Dr. Shazia Anjum, and she knows she's been associated with SETI and with Dr. Jain in the past as well. Dr. Shazia, you've been hearing us, you know, what we are talking and what we're going to bring next. So may I request for your views?
Good evening, everyone. This is Dr. Shazia. I am with the World Health Organization for almost 12 years now. I'll keep my video on, but of course my photo looks better than my real pic now. Anyways, as far as the end tuberculosis strategy goes, we all know that it is declining the TB incidence by 80% of what it was there in the year 2015, and by 90% of reduction in the actual number of TB deaths, and of course to have zero catastrophic expenses on the patient's pocket. So in terms of translating it to Indian scenario, we all know that in the year 2015, the incidence of tuberculosis was 217 per lakh per year, which is to be now reduced to 44 cases per lakh per year by 2025, as per our own Honorable Prime Minister Shri Narendra Modi ji's commitment in the year 2018. Now, if we look at the incidence of tuberculosis, it's 29,50,000 TB patients all over India, which translates to 210 patients per lakh per year. Frankly speaking, if we think of eliminating TB, it is bringing down the cases to such an extent that there would remain less than one notified TB patient per million population, which is definitely a dream which is very far. However, we can always eye at ending TB as per WHO strategies. So as per this strategy, we also have planned similar targets for all the districts and the state, called a process called subnational certification, wherein we in Karnataka, at least, we have gone a step further in designating not just TB-free district or state. We are now looking at a Kshayamukta Gram Panchayat. In this regard, it is imperative to include all stakeholders, public, private, civil societies, NGOs, and TB champions. In Chamarajanagar, at least in the year 2022, there were 139 private practitioners, 25 labs, and 229 chemists who have been registered on Nikshay so far. However, 40 of them have notified around 180 TB patients out of the total 1,190 patients. We also have a unique model of steps in Karnataka, which is system for TB elimination in private sector. Already we have 399 step centers in Karnataka, wherein every private practitioner will take the onus of treating his own patients, including provision of public health action. So I'm happy to say that the fixed drug combination and the diagnostic technologies will also be provided to these practitioners from the government if they wish to do so. Importantly, the chemists also have a very dire role in maintaining the Schedule H1 registers for anti-TB drugs and notifying any missed notifications of the districts. And I'm very sure that the drug sale data, which is collected by these chemists, are very important for declaring any district as a TB-free districts under the subnational certification. You also know that malnutrition is one of the biggest factor or an attributable risk factor for TB, for which Government of India has launched the Pradhan Mantri TB Mukt Bharat Abhiyan. So I would only urge that the NGOs, civil societies, corporates, industrial associations, elected representatives, and the Gram Panchayat members, including the community as a whole, come together and play a very important role in becoming Nikshay Mitras under the Pradhan Mantri TB Mukt Bharat Abhiyan. So finally, I urge all the stakeholders, basically all the Brahmas, Vishnus, Maheshwaras, the Indras, to come together to eliminate the Yama called from Chamarajanagar. Thank you so much for this opportunity.
Thank you, Dr. Shazia. You have said it so well. And Dr. Jain, your comments.
Sure, absolutely, Dr. Shazia. You've given the steps and especially given the steps program, which is there directed for the private practitioners. There is no question in all of our minds that the private practitioners are a major player in reaching out and finding the TB patients. We believe that 25 to 50% of TB patients, varying from district to district, are first coming to the private practitioners and being managed by private practitioners. And so private practitioners, you are a key to make this happen. Thank you so much.
Thank you, Dr. Jain. Thank you, Dr. Shazia, so much. And before I invite our DHO, he's already here, our state tuberculosis officer, Dr. Anil, has already joined. And Dr. Anil, we welcome you. And, I would just like to update you in about 30 seconds, what has happened and, what is our objective. Well, sir, you have seen SETI in various projects. We've had the good fortune of, interacting with you in person also. And we were, first of all, very thankful to you and to the central government and to the Central TB Division. And especially, I would like to take the name of Dr. Joshi, Deputy Director General, Central TB Division, and you in the same breath for giving us this opportunity to make Chamarajanagar TB free. Our objective today, as we know that, we need to do more to bring the private practitioners and the pharmacists on board. So our single most objective today is to not only make them aware about the various government policies, but at the end of the session, make it as if it is, they should look forward to notifying a TB patient to the public sector. That is how we wish to make the pitch. So with this, I welcome you and may I request you to share your views. Dr. Anil.
Thank you. Good evening, everyone. It's a pleasure to be with the city. And this TB, which is a disease which has been with us for 5,000 years. Now we are saying that we would end TB by 2025, is a fallout of the bold decision taken by the Honorable Prime Minister. And since then, the state has taken a slew of measures that would help in reducing the burden of TB. For all the private practitioners here and the pharmacists, the message is loud and clear that Chamarajanagar should be TB free. How it can be TB free is by notifying every single patient that you have diagnosed as TB. Let us not miss any case of TB that is there in the private sector. Why should you notify TB? That's the question that is usually asked by every private provider. Why should I notify TB? So, tamgella gottide. TB is an airborne infection. Adu ಗಾಳಿಯಿಂದ ಹರಡತಕ್ಕಂತ ಒಂದು ಸೋಂಕು ರೋಗ. ಹಾಗಾಗಿ it is from what the private practitioner finds difficult to do, the public health actions ಅಂತ ನಾವು ಏನ್ ಹೇಳ್ತೀವಿ ಅದನ್ನ Ravi and his team, the district TB officer and his team can definitely do, be it contact tracing, be it looking at their sugars, be it HIV testing, giving NPY. Every diagnosed TB patient, irrespective of whether they are BPL or APL, are provided 500 rupees during the course of treatment. The drugs are quite expensive. Some of them drop medications because they can't afford to buy the drugs. The cost of treating a TB patient is free for them, but the government pays. The cost of treating a drug-resistant TB is somewhere around 80,000 to 5 lakh rupees. How many of them can afford these 5 lakh rupees? So all these public health actions that are required will be taken by Ravi, and that can be done only if the patients are notified to us. So there will be confidentiality issues, the confidentiality of the patient and the disease, the provider, everything will be maintained in the most systematic way. So that is the first part of it, requesting the private clinicians who are here to notify TB patients. And the first, if we have to eliminate TB, the first thing that we have to do is to have an early clinical diagnosis or early microbiological confirmation of TB. So the symptoms of TB are so varied and overlapping. Cough is the predominant symptom, which we see around 68 to 70% of the pulmonary TB patient. And cough, most of you know, can be because of from bronchitis to COPDs to ILDs to malignancies to TB, so unresolving pneumonias, even worm infections, ascariasis of the lungs can cause chronic cough. So helminthiasis, to be precise, all these can cause cough. But then most of the time, what happens when the patient comes with cough, the usual prescription of an antitussive or a mucolytic or an antibiotic, like that, along with that, a needle of suspicion of TB should always be ingrained in us. Now, yavaglu nodtivi, if you go back to the history of any diagnosed TB patient, he will give that he has visited at least 2 to 3 people before being diagnosed as TB. This delay causes the transmission of disease. And let me tell you that one untreated TB patient in a year can transmit the disease to 10 to 15 healthy people. So hagagi, it is imperative that our focus should be on early diagnosis, early suspicion of TB. And the second part of it is making the right treatment regimen for the patient, not to switch regimens. Like it is so very common that we see a patient, we feel or patients say that I am not responding. Even without evaluating, we switch antibiotics. That should be restricted and refrained while we are treating TB, because it leads to augmenting the drug resistance. So compliance to medications from the patient side, ensuring that he is compliant to medications, giving the right kind of drugs is also very important. Since the treatment duration is around 6 to 9 months, obviously he needs a treatment supporter, and that is being provided by the system. So all the private providers can utilize the facilities that are available within the public health system, be it the nucleic acid amplification test, be it the DRTB wards, be it the DRTB drugs, the patient support systems that we reimburse the patients on the money that he has traveled to the DRTB center. All these things are available with us that can be utilized irrespective of whether they are private patients or public health patients. So my sincere request, TB-free Chamarajanagar is possible. So the private can play a major role in our efforts to end TB by 2025. likewise, the chemists have a very broad sense of role in giving us what is the consumption of the AKT4s, or to be very precise, how much of rifampicin based compounds are they selling on a monthly basis. This gives us a surrogate marker of how many patients are there within the private health system seeking care, and that will help us to modify our strategies, rework on our energies to make Chamarajanagar TB free. And the many things that I wish to share, but constrained to time. Thank City for the PDSA program. Probably this will be the most sought after program for the entire country. And I request the entire team at Chamarajanagar, the DHO, DTO, the health, all the health team under the leadership of the Chief Executive Officer of Zilla Panchayat to lead this initiative and make Chamarajanagar TB free. Thank you all.
Dr. Manoj.
Thank you so much, Dr. Anil. Your leadership and as an STO in Karnataka is phenomenal. And you have seen our workings and you have outlined the single most important thing that our private practitioners can do. And the entire government structure is supporting the entire international community, even NRI doctors. Today, I connected with over 500 NRI doctors, and many of them from Karnataka, and very interested in helping. And so the single most important thing, our private practitioners, is early detection. So with that, thank you so much, Dr. Anil, and your leadership and support.
Thank you, Dr. Manoj. Thank you, Dr. Anil. Thank you so much. I know you were with the health minister just about 10-20 minutes ago, but you gave me a call and you very much wanted to be a part of our meeting as well. Thank you. And all the issues that you raised, confidentiality will be maintained. Benefits which will come to the private practitioners, material or whichever form, and why should they notify, and the legal provisions, everything we will bring it in discussion when the DTO comes in. And Dr. Anil, Dil Mange More, I would be requesting that, we need your presence tomorrow as well, when we are doing the same program tomorrow at Mysore. So thank you. With this, I take opportunity to invite our district health officer. He has been experiencing some network issue, but I think he is here and he can hear me. Dr. Vishwesharaya, district health officer, Chamarajanagar, welcome. May I request you to share your views? He is entering now. Can you hear me?
He has a poor network. I'm not sure if he can speak.
I know. Dr. Vishwesharaya, if you can hear me, sir, you can please share your views. Okay, may I request Dr. Ravi, if we can, okay, but Dr. Ravi is required now. So it's okay. Once DHO joins in, we will bring him in. So, dear private practitioners and pharmacists, we now invite, a kind of a panel. Dr. Basavarajendra, are you there? I am sorry, I didn't check up on you. And Ms. Ashalatha, can the DTO confirm to me? Can somebody confirm to me? So, yes. Yeah. So now we will be inviting Dr. Ravi Kumar, who was the district tuberculosis officer for Chamarajanagar, who holds the Sudarshan Chakra and who has the onerous responsibility to make Chamarajanagar TB free, in talk with Ms. Devlina Chatterjee, who is an assistant consultant with our organization, that is SETI, Collaboration to Eliminate Tuberculosis Among Indians. I also take this opportunity to invite Dr. Basavarajendra. He's the president of the Indian Medical Association chapter at Chamarajanagar, as also Ms. Asha Latha, assistant drug controller. So we have the entire, body here. One, to make the awareness, close the gaps, tie the loose ends. Second is, through whom the IMA president, through whom we can reach all the private practitioners in one go with all our messages, and the assistant drugs controller, who is kind of, an appellate authority guiding all the pharmacists. So, Devlina, I hand over to you. Would you like me to continue sharing the screen, or would you like to control it yourself?
Yes, sir. Thank you so much. So you may control the screen. That is not a problem at all. Okay, thank you so much and welcome everyone. This is Devlina Chatterjee, Assistant Consultant for CETI. Thank you so much for joining in this session. To begin with, I would also like to thank you, Dr. Basav Rajendra, IMA President, and Ms. Asha Lata, Assistant Drugs Controller. Thank you so much for joining with us. We just heard about tuberculosis notification by pharmacists and our private practitioners. I would just like to know from Dr. Ravi Kumar, what does tuberculosis notification exactly means, and who shall be the people who will be notifying these patients?
Yes, thank you, and notification has been made mandatory in our country. The law has been passed since 2012. All TB cases should be notified. Notification means, as already said by our STO and JD sir, that all TB cases, if they are not notified and public health action is not taken, so since it's a communicable disease and it goes on spreading, so to contain that and to take public health action, notification is very important, and it has been made compulsory, or the law has been passed. Actually, notification starts with the enrollment of a presumptive TB case. It has to happen on the Nikshay portal, which is the official portal for our program, that is NTEP under CTD, Central TB Division. And any patient who is suspected to have TB, when he is subjected to sputum examination or X-ray examination or any extrapulmonary tissue testing, first he has to be enrolled on the Nikshay. So once the test results come out and if it proves to be diagnosed to be a TB case, then the notification has to be done by entering the test results. So this is mandatory. This is how this notification itself is not the first step, but sometimes it so happens that without enrollment, some patients will be diagnosed as TB. So then this process takes a little bit of, a little bit of a change, but ultimately even those cases will be notified. So it can be done at all government and private hospitals. And we have given what is called as Nikshay ID and password to all the government health facilities and also to 139 health facilities in our district, of which 104 are functional now. And actually now, out of the 104, only 7 are doing this enrollment and notification process. Rest of the private doctors, what they are doing is they are contacting our NTP staff whenever they find a suspected case, and they take their help in doing the enrollment. So illira private practitioners ellargu gottide, nimge ellargunu onondu Nikshay ID matte password anta koಟ್ಟಿದೀವಿ. ಅದರಲ್ಲಿ ನೀವೇನೇ ಯಾವುದೇ ಪೇಷಂಟ್ ಗೆ TB ಇದೆ ಅಂತ ಸಸ್ಪೆಕ್ಟ್ ಮಾಡಿದ್ರೆ ಫಸ್ಟ್ ಎನ್ರೋಲ್ ಮಾಡ್ತೀರಾ, ಪಾಸಿಟಿವ್ ಆದ್ಮೇಲೆ ನೋಟಿಫಿಕೇಶನ್ ಆಗುತ್ತೆ. ಈಗ ಇರುವಾಗೆ ನಮ್ಮ ಸಿಸ್ಟಮ್ ಅಲ್ಲಿ ಕ್ಲಿನಿಕ್ಸ್ ಗೆ ಎಲ್ಲದಕ್ಕೂ ಸಹ Nikshay ID ಮತ್ತೆ ಪಾಸ್ವರ್ಡ್ ಕೊಟ್ಟಿದ್ದೀವಿ. We have given that.
Okay, so you very well told that it is possible by Nikshay portal, but what if I do not have a computer or a desktop present in front of me? How should I notify them?
Yeah, it's a simple process. As I told, if you don't have that facility or system, or if you don't have a smartphone also, you can always contact our NTP staff and they will do the work for them. So in each taluk, there are what we call as TUs. We have 6 TUs, tuberculosis units, and we have made groups wherein the private practitioner, or whether if a pharmacist finds a new case coming in with prescription of anti-TB drugs, they can inform our NTP staff and they will do the rest of the things in their name.
Okay, Great. Dr. Ravi Kumar, I would also like to know how should they inform the NTP staff? Can they use the Google Forms to, immediately inform which can work like a real-time notification for the NTP staff? Is it possible?
Yeah, I think we don't have this Google formats now. As of now, what we are doing is on WhatsApp, they are sending the details. And sometimes as the private practitioner is unable to do, we will do it for them. So the next step is, I think we can go in for something like Google Forms where it will be simplified and they can send on the Google Forms so that NTP staff can do it better in a fast way.
Okay, great. Can you also help the audience understand what are the correct time to notify a patient? When should a patient be notified by the pharmacists and the private practitioners?
Yeah, definitely. After the enrollment, enrollment ಆದ ತಕ್ಷಣ enrollment ಅಂತಂದ್ರೆ ಆ patient ನ ನಿಕ್ಷಯ್ ಪೋರ್ಟಲ್ ನಲ್ಲಿ ರಿಜಿಸ್ಟರ್ ಮಾಡೋದು, ಟೆಸ್ಟ್ ಮಾಡೋದಕ್ಕೆ. ಅದರಲ್ಲಿ patient details ಎಲ್ಲ ತಗೊಂಡಾದ ತಕ್ಷಣ enrollment ಅಂತ ಆಗುತ್ತೆ. enrollment ಆದ್ಮೇಲೆ ಟೆಸ್ಟಿಂಗ್ ರಿಸಲ್ಟ್ಸ್ ಬಂದ ತಕ್ಷಣ it has to be notified. Results update ಮಾಡ್ತಿದ್ದಂಗೆನೆ that will become a notified case, and it can be done at the point of diagnosis or just before at the time of initiation of the treatment. At the point of sale, if somebody is coming with a prescription, they can inform our NTP staff and they will do it. And even laboratories and diagnostic facilities which are attached to the hospital, which have a NICSHA ID and password, they can do it there. So at the beginning itself, so enrollment aagta iddagene next step positive aad takshana it will be notified.
Great. If you can also help us understand what are the basic symptoms and what are the different drugs that are on sale for ATT or tuberculosis.
We have sensitized almost all of our private practitioners in all the taluks. ಎಲ್ಲರಿಗೂ ಗೊತ್ತಿರೋ ಹಾಗೆ 2 ವಾರಕ್ಕಿಂತ ಹೆಚ್ಚಿಗೆ ಇರುವಂತ ಕೆಮ್ಮು, ಜ್ವರ, ಹಸಿವು ಕಮ್ಮಿ ಆಗೋದು, ತೂಕ ಕಮ್ಮಿ ಆಗೋದು, ರಾತ್ರಿ ಹೊತ್ತು ಬೆವರುವಂಥದ್ದು ಅಥವಾ ಕಫದಲ್ಲಿ ರಕ್ತ, ತೂಕ ಕಡಿಮೆ ಆಗ್ತಾ ಇರುವಂಥದ್ದು ಮತ್ತೆ ಹಸಿವು ಕಮ್ಮಿ ಆಗೋದು, these are the main symptoms. ಮತ್ತೆ ಚೆಸ್ಟ್ ಪೇನ್ ಇದಲ್ಲ, these are the typical common symptoms of TB. ಮತ್ತೆ ಎಕ್ಸ್ಟ್ರಾ ಪಲ್ಮನರಿ ಕತ್ನಲ್ಲಿ ಗಂಟು ಕಾಣುವಂಥದ್ದು ಅಥವಾ ಬೇರೆ ಯಾವ್ದಾದ್ರು ಅವ್ರಿಗೆ ಜೀರ್ಣ ಶಕ್ತಿನಲ್ಲಿ ಕಮ್ಮಿ ಆಗಿರುವಂಥದ್ದು, ಇನ್ಫರ್ಟಿಲಿಟಿ, ಬಂಜೆತನನು TB ಇಂದ ಇರಬಹುದು. ಸೊ ಈ ತರದೆಲ್ಲ TB symptoms, chief symptoms ಇದಾದ್ರೂ it can present in a complex way wherein the clinician has to evaluate and properly approach the case.
Dr. Ravi, we also have IMA president and ADC madam with us. If you can also involve them in this conversation, that would be great.
Yeah, sir, Basarajandra sir join agidira?
Yeah, he's there. He's there. He had raised his hand also sometime before. Okay, by the time we locate him.
ADC madam idira? Ashalata.
Hello. Yes, sir.
Yeah, sir. Both of them. Dr. Basavarajandra is also there.
Yes, sir.
Sir, is it audible?
Yes, sir. Audible, madam. Audible.
Sir, Basarajandra sir, ಈಗ ನಿಮ್ದು ಹಾಸ್ಪಿಟಲ್ ಸ್ಟೆಪ್ಸ್ ಅಲ್ಲಿ we have collaborated you as a step center and ನಿಮ್ಮ ಹಾಸ್ಪಿಟಲ್ ಅಲ್ಲಿ ಎಲ್ಲ ಮಾಡ್ತಾ ಇದ್ದೀರಾ. ನಮ್ಮ ಅಲ್ಲಿ 7 hospitals doing the enrollment and notification ಅಲ್ಲಿ ನಿಮ್ದು ಒಬ್ರು ಚೆನ್ನಾಗಿ ನಮ್ಮ NTP ನಲ್ಲಿ ಪಾರ್ಟಿಸಿಪೇಟ್ ಮಾಡ್ತಾ ಇದ್ದೀರಾ. ನಿಮ್ದು ನೀವು ಎಕ್ಸ್ಪ್ಲೇನ್ ಮಾಡಿದ್ರೆ ಬೇರೆ ಪ್ರೈವೇಟ್ ಪ್ರಾಕ್ಟಿಷನರ್ಸ್ ಸ್ವಲ್ಪ ಅದರ ಇಂಪಾರ್ಟೆನ್ಸ್ ನ ಎಲ್ಲ ಚೆನ್ನಾಗಿ ತಿಳ್ಕೊತಾರೆ ಅಂತ ಸರ್.
Yes, sir. So I'm happy to join this meeting, sir. And we involved in this TB elimination, TB Mukt Bharat. And as I am a president and as a practitioner of Chamarajanagar, so we taken these steps and with the help of Ravi Kumar and their team, we are doing well in this program. And earlier we used to write the prescription outside and all, but now we got the medicines from the government itself, and we are distributing the medicines directly, and we are doing the sputum examinations. And also we encouraged our all practitioner, private practitioner, including the Ayurvedic and other practitioners, to join this program. And they are also sending these sputums. we are communicating with Mr. Ravi Kumar and Dr. Ravi Kumar and their team. So we are getting good response from the government also, so that the patients also responding well, and they are taking. Earlier they are reluctant to take government medicines, as you know. So nowadays they accepted and they are taking medicine and they are doing well, madam.
ಆಶಾಲತಾ ಮೇಡಮ್, ಈಗ ಶೆಡ್ಯೂಲ್ ಈಗ ಫಾರ್ಮಸಿಸ್ಟ್ ಇಂದ ಅನೆಕ್ಷರ್ 3 ನ ಅವರು ರೆಗ್ಯುಲರ್ ಆಗಿ ನಮಗೆ ಕೊಡ್ತಾ ಇದ್ದಾರೆ.
ಹೌದು ಸರ್.
ನನಗೆ ಗೊತ್ತಿರೋ ಮಾಹಿತಿ ಪ್ರಕಾರ ನಮ್ಮಲ್ಲಿ 229 ಫಾರ್ಮಸಿಸ್ಟ್ ಇದ್ದಾರೆ. ಅದರಲ್ಲಿ 11 ಫಾರ್ಮಸಿಸ್ ಅಲ್ಲಿ ಆಂಟಿ ಟಿಬಿ ಡ್ರಗ್ಸ್ ನ ಸೇಲ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ ಅನ್ನೋ ಮಾಹಿತಿ ಇದೆ. ಬಟ್ ಸ್ಟಿಲ್ ನಮಗೆ ರಿಪೋರ್ಟ್ ಕೊಡ್ಬೇಕು ಅಂತಾನೆ ಇದೆ. ಸೊ ಶೆಡ್ಯೂಲ್ ಹೆಚ್ ಡ್ರಗ್ಸ್ ಏನಿದೆ ಅಂತ ಒಂದ್ ಸ್ವಲ್ಪ ನೀವು ತಿಳಿಸ್ಬಿಟ್ರೆ ಜಾಯ್ನ್ ಆಗಿರೋರಿಗೆ ಅವ್ರಿಗೆ ಒಂದು ಕ್ಲಿಯರ್ ಐಡಿಯಾ ಬರುತ್ತೆ.
Ha, sir. Sir, good evening to all. First of all, thanks to the team. Hello. Sir, we already intimated to our, we are instructed to our chemist strictly to maintain the, first of all, Schedule H1 drugs register, sir. They are maintaining the Schedule H1 drugs register, sir, manually, and also some chemists are maintaining through computerized systems, sir. Computerized bills they are maintaining. And also we strictly instructed to submit the patient details in Annexure 3, sir. Those who are purchasing that TB drugs from chemist, I instructed to our chemist to submit the details every month to you also, and also meanwhile to us also. And also I'm also submitting to you monthly, regular monthly wise. Hello, sir. Is it audible?
Yes, madam.
Yes, madam. We can hear you very well. Very clearly, we can hear you. Please go ahead.
Yes, sir. Yes, sir. So actually, some chemists already, I think 60 to 65 chemists, they have joined in this seminar, sir. So togetherly, without private practitioners and without our pharmacists and without our support, it is very difficult to this one. So all of we together we will join, and togetherly we will eliminate the TB, sir. So this much I'll tell you, sir. Thank you.
Thank you. Thank you so much, Ashalataji. Thank you so much. No, Dr. Ravi, I have one question to both Dr. Basava Rajendra and to Ashalataji.
Yes, sir. Yes.
And my question is common question to both of you, that if we have to reach out to the private practitioners, if we have to reach out to the pharmacists, and we want to close gaps, we want to build more understanding, we want to keep them more informed, how can you help the DTO in becoming his supporting structure? May I request Basava Rajendra ji first?
Sir, we are the bridge between the government and the patients now, just like and we are doing that job. Earlier, it was a little bit difficult because they have to get the medicine from the government itself. When we referred reaching the government and getting the medicines, there was a delay and a lot of gap was there. Now it is not the scenario, sir. Now we have medicines with us only, so that it's easy to administer and start. And certain cases, those who are all local or regular for us, we are also following and we are also treating. And if they are from far away, we'll just refer the medical officer nearby PHC, and we'll intimate through phone. And we have a WhatsApp group also. We'll share the things with the WhatsApp group. And nowadays it's very easy, sir. Only thing is the practitioner who is working in a clinic, they are facing little bit problem in collecting samples and sending to the government. So we have a discuss with these people, and we said, you please collect the sample and the patient phone number and history. The rest of the thing, the Dr. Ravi and team is taking care of the things. So that it is easy for the practitioner also, and we are following that one, sir, so that we'll avoid missing the cases also.
Thank you, Dr. Basavaraj. But then, I have a problem since birth. I have this problem of dil mange more. So I will ask you more. Can I go ahead more?
Yeah, definitely, sir.
Okay, sir. Thank you so much. And you can respond in Kannada, sir. because intention is to ask through you those questions which are in everybody's mind. Because I am sure all these private practitioners are having common questions, so I'll ask them through you. Very nicely you said about the WhatsApp groups, and I'm sure you will be having access to all the private practitioners, their WhatsApp numbers, and you must be sharing with them many guidelines or many matters which pertain to IMA. Sir, can we every 21 days put something about TB in this group so that nobody forgets about this? And I will request the DTO, Dr. Ravi, to share that small clip, and I will make it for you, sir, so that every 21st day we refresh all the doctors about something called TB, and we do it for next 2 years. This is my first dil mange more from you. And second,
now ಹಾಕ್ತೀವಿ ಸರ್ ನಮ್ಮ ಗ್ರೂಪ್ ಅಲ್ಲಿ ರಿಮೈಂಡಿಂಗ್ ಕಾಲ್ ಹಾಕ್ತೀವಿ ಅಂಡ್ ಅಲರ್ಟ್ ಮಾಡ್ತಾನೆ ಇರ್ತೀವಿ ಸರ್ ನೀವು ಹೇಳಿದ್ಮೇಲೆ we will start doing that sir.
So Dr. Ravi, we will not let people forget. Yes, Dr. Jain, tell me, you're saying something?
Yes sir, that's what I said. I do agree with that.
Yeah, so first thing is we will not let people forget only this thing. Okay, my second is samples collection can happen through courier as well, and dispatch can happen through courier as well. It is being practiced in the country. I'm saying dispatch. If at all you want the diagnosis to be done at Dr. Ravi's facility, and he has facilities across the district. Am I right, Dr. Ravi?
Yes, sir.
Okay. Dr. Ravi, I am asking a question again to you and with Dr. Basavaraj, so that, to re-emphasize. If there is a private practitioner who wants to notify, he has forgotten how to utilize Nikshay, and now he is hesitant in asking, what can we do? Can we teach him again? Will you be sharing the contact details or something later on by the end of the session? That, one-stop query, anything you wanted to know from the DTO, here is my number. Is something like that planned?
Yes, sir. Yes, sir. Actually, we have made ourselves very accessible to all the private practitioners across the district. We have not left anyone untouched in this matter, and they can access our NTP staff, that STM, STM, PHV, or even BPM, DPC, and all are accessible for all the. We have shared information repeatedly, their phone numbers, and we even personally, I myself keep reminding them whenever the presumptive examination rate goes down, I keep reminding them, and we are in touch. And about this Nikshay, I can definitely give them another sensitization or anything like that.
Thank you.
We are there to facilitate them.
Okay. So while we are talking just now, Dr. Basavaraj, all DTO's team is there in the WhatsApp group. I am requesting them to send a message right now of all the contact details, and the private practitioners and the pharmacists can save it. As I am talking to you, the message is going into the WhatsApp group now, Dr. Basava, Rajendra. So that is one more thing. And third is, Dr. Ravi Kumar brought out that, he can work on Google Form. If a private practitioner does not have much time, we can use technology also. If he finds it difficult, he's saying that he's all ready to come all the way forward. Dr. Asha Lata, can you tell us what can you do to help the DTO, become a strong health structure for him?
Sure, sir. Sure, sir. Sir, first thing is, sir, navig already ನಮ್ಮ chemists ಗಳಿಗೆ ಅವ್ರದ್ದು ಒಂದು WhatsApp group ಇದೆ sir. So if any patients or any ಏನಾದ್ರು ಅವರಿಗೆ ಹೊಸ patient ಬರ್ತಿದಾರೆ ಅಂದ್ರಲ್ಲಿ ಅವ್ರ group ಅಲ್ಲಿ all over Chamarajanagar district they have that WhatsApp group, sir. Chemist group only. So they will take patient information, sir. If any new patients will come, they will take their informations. Collectively, they will give mainly in Chamarajanagar 2 persons, 2 medicals. They will give more details, sir. That is Krishna Medicals and Ashit agencies. Regularly, they are in touch with us also, and also they are in touch with Ravi Kumar sir, Dr. Ravi Kumar sir also, and also TB coordinator, that Charan also. And immediately they will intimate the patient's details to him also and to us also, sir. And also I instructed to our chemist to, hello?
Yes, please go ahead. Go ahead, ma'am.
Yes, sir. So, hello, sir. Are you, is it audible, sir?
Yes, very nicely. We can hear you. Please go ahead.
Yes, sir. So, finally, we are supporting to our Chamarajanagar team, to the Dr. Ravi Kumar, to make the TB Mukt Bharat, especially TB Mukt Chamarajanagar, sir.
Thank you, madam. Over to you, Devlina. Dr. Jain, if you have some remarks, observations, or something.
So I'll be very brief, Dr. Bhasava Rajendra, as a IMA president, you have lots of responsibilities, but you also have lots of contacts and connections. Your word carries a lot of weight. And so you're being here and you're saying the things that you're saying about TB and allowing this information to permeate. 25 to 50% of the patients are coming to the private doctors for TB, and that's over 500 to 700 patients that are there every year. So that makes a huge difference. And Ms. Ashalata, from the drug perspective, thank you so much for your support and really being part of the broader dream and vision.
Thank you so much, sir. Thank you.
Thank you, Dr. Jain. And Devlina, if you can kindly make a note that we will not let the private practitioners and the pharmacists forget. So every 21st day, we should send a small slide message, which can be shared. And Dr. Ravi, 1 week we will plan when all the private practitioners and the pharmacists of Chamarajanagar, for 1 week, they will change their DP. And, we'll have TB-free Chamarajanagar on their WhatsApp, this thing. So we'll celebrate that for 1 week so that we don't forget. Nothing else, just that we don't forget. So with this, Devlina, please take it forward.
Yes, thank you so much. So here I take you to the most interesting part of the session, which are what are the benefits that a person might get when they notify. So Dr. Ravi, if you can put some light on these benefits. You are on mute, sir. You will have to unmute yourself.
As a DTO, first of all, let me tell you, impress upon why we are engaging the private practitioners so much. ಎಲ್ಲರೂ ಅರ್ಥ ಮಾಡ್ಕೋಬೇಕು private practitioners. ಒಂದು ನಂಬರ್ಸ್ ಹೇಳ್ತೀನಿ, you just look at the numbers. In 2022, ನಾವು ಗವರ್ಮೆಂಟ್ ಸೆಕ್ಟರ್ ಇಂದ ಟೆಸ್ಟಿಂಗ್ಸ್ ಮಾಡಿರೋದು 18,743, 18,743 ಟೆಸ್ಟ್ ಮಾಡಿದೀವಿ, ಸ್ಪುಟಮ್ ಟೆಸ್ಟಿಂಗ್. ಅದರಲ್ಲಿ ನಮಗೆ ಪಾಸಿಟಿವ್ಸ್ ಬಂದಿರೋದು 1097 ಪೇಷಂಟ್ಸ್ ನಾವು ಡಯಾಗ್ನೋಸ್ ಮಾಡಿದೀವಿ. ನಿಮ್ಮ ಪ್ರೈವೇಟ್ ಸೆಕ್ಟರ್ ಇಂದ ನೀವು ರೆಫರ್ ಮಾಡಿರುವಂತದ್ದು ಇಡೀ ವರ್ಷಕ್ಕೆ ಇಡೀ ಜಿಲ್ಲೆಯಿಂದ 621, 621 ರೆಫರಲ್ಸ್, ಅಂಡ್ ಆಫ್ ದೋಸ್ 621 we have got 180 positives. ಸೊ ಡಿಫರೆನ್ಸ್ ನೋಡಿ, ಗವರ್ಮೆಂಟ್ ಅಲ್ಲಿ for 18,700 we are having 1,097 positives, means it's around 5 to 6%, which should have been nearly 10% normally. But in private sector, for 621 we have 180 positives, means it's 20%. So nimdu involvement is important in that. So your referrals should increase. So referrals increase andre yen benefits ida nimge anta nodidre, see, the benefit is huge to the society and to the country, because it's a social disease which is causing a lot of burden socio-economically, with all the stigma and discrimination taken into account. So practitioners as an incentive, see, this is not an earning, this is an incentive, it's an encouragement incentive. ನೀವು ರೆಫರ್ ಮಾಡಿದ್ರಲ್ಲಿ ಪಾಸಿಟಿವ್ ಬಂದ್ರೆ ನೋಟಿಫಿಕೇಶನ್ಗೆ 500 rupees ಇರುತ್ತೆ. At the end of the treatment, if you give the outcome, like patient care ನೀವೇ ನೋಡ್ಕೋತಾ ಇದ್ದು ಔಟ್ಕಮ್ ನ ನಿಮ್ ಕಡೆಯಿಂದಾನೇ ಆದ್ರೆ ಅದಕ್ಕೆ 500. So 1,000 rupees will be the incentive, notification and outcome incentives. So per patient 1,000 rupees incentive ಇರುತ್ತೆ. ಅದಲ್ಲದೆ ನಿಮ್ಮ ಸಿಸ್ಟಮ್ ಅಲ್ಲಿ, ನಿಮ್ಮ ಹಾಸ್ಪಿಟಲ್ ಅಲ್ಲಿ ಅಥವಾ ನಿಮ್ಮ ಹತ್ರನೇ ಯಾರಾದ್ರೂ ಡಾಟ್ಸ್ ಸೂಪರ್ವಿಷನ್ ಡ್ಯೂರಿಂಗ್ ದ ಫುಲ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಟೈಮ್ ಮಾಡಿದ್ರೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಸಪೋರ್ಟ್ ಹಾನೋರೋರಿಯಂ ಅಂತ ಯೂಶಲಿ ವಿ ಆರ್ ಗಿವಿಂಗ್ ಇಟ್ ಇನ್ ಅವರ್ ಗವರ್ಮೆಂಟ್ ಸೆಕ್ಟರ್, ಆಶಾಸ್ ಆರ್ ವಾಲಂಟಿಯರ್ಸ್. ಈ ತರ ನಿಮ್ಮಲ್ಲೇ ಯಾರನ್ನಾರು ಐಡೆಂಟಿಫೈಡ್ ಮಾಡಿ ಡಾಟ್ಸ್ ನ ಸೂಪರ್ವೈಸ್ ಮಾಡ್ತಾರೆ ಅಂತ ಅಂದ್ರೆ ಅವ್ರಿಗೂ ಸಹ ನಾವು ವಾಲಂಟಿಯರ್ ಅಂತ ತಗೊಂಡು ಟ್ರೀಟ್ಮೆಂಟ್ ಸಪೋರ್ಟ್ ಹಾನರೇರಿಯಂ ಕೊಡ್ಬೋದು. ಅದಲ್ಲದೆ ನಿಮಗೆ ಬರೋ ಬೆನಿಫಿಟ್ ಇದಲ್ಲದೆ ಯಾವುದೇ ಪೇಷಂಟ್ ಡಯಾಗ್ನೋಸ್ ಆದ್ರೂ ಸಹ, ಈಗ ನಾನು ನಮ್ಮ ಜಿಲ್ಲೆನಲ್ಲಿ ಪ್ರೈವೇಟ್ ಇಂದ ರೆಫರ್ ಆಗಿದ್ದ ಪೇಷಂಟ್ಸ್ಗೆಲ್ಲ ಅಪ್ ಫ್ರಂಟ್ ಟೆಸ್ಟಿಂಗ್ ಕೊಡ್ತಾ ಇದ್ದೀನಿ. ನಿಮ್ಗೆ ಗೊತ್ತಿದೆ ನಾಟ್ ಟೆಸ್ಟಿಂಗ್ ಕಾಸ್ಟ್ ಎಷ್ಟಿದೆ ಅಂತ. ಸೊ ಕೀ ಪಾಪ್ಯುಲೇಷನ್ ಮಾತ್ರ ಕೊಡ್ತೀವಿ ನಾವು, ಯಾರಿಗೆ HIV-ಗೆ ಅಥವಾ ಡಯಾಬಿಟಿಕ್ಸ್ಗೆ ಮತ್ತೆ ಯಾವ್ದಾದ್ರು ಕ್ರಾನಿಕ್ ಡಿಸೀಸ್ ಇರೋರಿಗೆ, ಈ ತರ ವಿತ್ ಹೈ ಸಸ್ಪಿಷನ್ ರೇಟ್ಸ್ ಇರೋರಿಗೆ ಕೊಡ್ತೀವಿ. ಅದರಲ್ಲಿ ನಾವು ಪ್ರೈವೇಟ್ ಇಂದ ಬರೋರಿಗೆ ಆದಷ್ಟು ನಾವು ಮಿಸ್ ಆಗ್ಬಾರ್ದು ಅಂತ ಹೇಳಿ ಎಲ್ಲರಿಗೂ ನಾಟ್ ಟೆಸ್ಟಿಂಗ್ ಕೊಡ್ತಾ ಇದೀವಿ. ಅದು ಕಾಸ್ಟ್ ನೀವೇ ಡೈರೆಕ್ಟ್ ಮಾಡಿ. ಮತ್ತೆ ಫಾಲೋ ಅಪ್ಸ್ ಅಷ್ಟೇ, ಫಾಲೋ ಅಪ್ ಎಕ್ಸಾಮಿನೇಷನ್, ಪೇಷಂಟ್ ಕೇರ್ ಎಲ್ಲ ನೀವೇ ಇಟ್ಕೊಂಡು ನೋಡ್ಕೊಂಡ್ರೆ ನೀವು ನೋಡ್ಬೋದು. ಇಲ್ಲ ಅಂತಂದ್ರೆ ನೀವು ನಮ್ಮ ಹೆಲ್ತ್ ಸಿಸ್ಟಮ್ ಕೊಟ್ರೆ ಅವ್ರದ್ದು ಫಾಲೋ ಅಪ್ ಕೇರ್ ಎಲ್ಲ ನಾವು ನೋಡ್ಕೋತೀವಿ. ಬಟ್ ಪೇಷಂಟ್ ವಿಲ್ ಬಿ ಅಂಡರ್ ಯು ಓನ್ಲಿ, ನಾವು ತಗೊಳ್ಳೋದಿಲ್ಲ. ಆಮೇಲೆ ಡ್ರಗ್ಸ್ ನಮ್ಮ ಸರ್ ಆಗ್ಲೇ ಹೇಳಿದ್ರು, ಮತ್ತೆ ಮೇಡಮ್ ಎಲ್ಲ ಹೇಳಿದ್ರು, ಫ್ರೀ ಆಫ್ ಕಾಸ್ಟ್. ಮೊದ್ಲೆಲ್ಲ ಏನಿತ್ತು, ನಾವು ಡಾಟ್ಸ್ಗೆ ನಮ್ಮ ಹತ್ರನೇ ಬರ್ಬೇಕು ಅಂತಿತ್ತು. ಈಗ ನಾವೇ ನಿಮ್ಗೆ ಮೆಡಿಸಿನ್ಸ್ ಕೊಟ್ಬಿಡ್ತೀವಿ. ಅದನ್ನ ನಮ್ಮ IMA ಪ್ರೆಸಿಡೆಂಟ್ ಡಾಕ್ಟರ್ ಬಸವರಾಜೇಂದ್ರ ಅವರು ಅಕ್ನಾಲೇಜ್ ಮಾಡಿದ್ದಾರೆ. ಸೊ ಡ್ರಗ್ಸ್ ನಿಮ್ಗೆ ಕೊಟ್ಬಿಡ್ತೀವಿ ಒಂದು ಪೇಷಂಟ್ಗೆ ಆಗೋಷ್ಟು, ಅದನ್ನ ನೀವು ಮಾನಿಟರ್ ಮಾಡ್ಬೋದು. ಸೊ ಫ್ರೀ ಡ್ರಗ್ಸ್ ಟು ದ ಪೇಷಂಟ್ ಹೂ ಇಸ್ ಅಂಡರ್ ಯುವರ್ ಕೇರ್. ಮತ್ತೆ ಪೇಷಂಟ್ಗೆ ಏನ್ ಬೆನಿಫಿಟ್ ಇದೆ, ಇಷ್ಟೆಲ್ಲ ಕೇರ್ ಅಲ್ಲದೆ ಜೊತೆಗೆ ನಿಕ್ಷಯ ಪೋಷಣ ಯೋಜನೆಯಲ್ಲಿ 500 rupees per month ಕೊಡ್ತೀವಿ ಅವ್ರಿಗೆ. ಟಿಲ್ ದ ಟ್ರೀಟ್ಮೆಂಟ್ ಇಸ್ ಯೂಶುವಲ್ 6 months ಟ್ರೀಟ್ಮೆಂಟ್ ಇದ್ರೆ 3000 rupees ಆಗುತ್ತೆ. MDR TB ನಲ್ಲಿ ವಿ ಗಿವ್ ಇಟ್ ಫಾರ್ ದ ಹೋಲ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಟೈಮ್ ಅಪ್ ಟು 2 years ಕೊಡ್ತೀವಿ. ಮತ್ತೆ ಪ್ರಿಫರೆನ್ಷಿಯಲ್ ಸರ್ವಿಸಸ್ ಆಸ್ ಪರ್ ಪೇಷಂಟ್ ನೀಡ್ಸ್ ಅಂತಂದ್ರೆ, ಅವ್ರಿಗೆ ಯೂಶಲಿ ಪ್ರೈವೇಟ್ ಸೆಕ್ಟರ್ ಬರೋರು ನನಗೆ ಐಡೆಂಟಿಫಿಕೇಶನ್ ಆಗ್ಬಾರ್ದು, ನನ್ ಪ್ರೈವಸಿ ಆಗ್ಬೇಕು, ನನಗೆ ಯಾರಿಗೂ ಗೊತ್ತಾಗ್ಬಾರ್ದು, ಅಂದ್ರೆ ಲೈಕ್ ನಾಟ್ ಬೀಂಗ್ ಎಕ್ಸ್ಪೋಸ್. ಸೊ ವಿಚ್ ಎವರ್ ವೇ ದ ಪೇಷಂಟ್ ಫೀಲ್ಸ್ ದಟ್ ಈ ನೀಡ್ಸ್ ದ ಟ್ರೀಟ್ಮೆಂಟ್, ಪ್ರೈವೇಟ್ ಸೆಕ್ಟರ್ ಅವ್ರಿಗೆ ಪ್ರಯಾರಿಟಿ ಕೊಡ್ತೀವಿ. ಬೇಗನೆ ಅವ್ರಿಗೆ ಯಾವ ತರ ಡಾಕ್ಟರ್ಸ್ ಏನ್ ರಿಕ್ವೆಸ್ಟ್ ಮಾಡ್ತಾರೆ ಅದನ್ನ ಕೊಡ್ತೀವಿ. ಸೊ ಇಷ್ಟೆಲ್ಲ ಮಾಡ್ತಾ ಇದೀವಿ. ಅದ್ರ ಜೊತೆಗೆ ನಮ್ದೇನು ಕಮ್ಯುನಿಟಿ ಸಪೋರ್ಟ್ ಅಲ್ಲಿ ಪ್ರಧಾನಮಂತ್ರಿ TB ಮುಕ್ತ ಭಾರತ ಅಭಿಯಾನಲ್ಲಿ ನಿಕ್ಷಯ್ ಮಿತ್ರಸ್ನ ಐಡೆಂಟಿಫೈ ಮಾಡಿ ಏನ್ ಸಪೋರ್ಟ್ ಕೊಡ್ತಾ ಇದಾರೆ, ನಿಮ್ ಪೇಷಂಟ್ಸ್ಗೆ ನೆಸೆಸಿಟಿ ಇದೆ ಅಂತ ನೀವ್ ಹೇಳಿದ್ರೆ ನಾವು ಕೊಡ್ತೀವಿ. ಅಥವಾ ನೀವೇನೇ ಬೇಕಂದ್ರೆ ಪೇಷಂಟ್ಸ್ ನ ಅಡಾಪ್ಟ್ ಮಾಡ್ಕೋಬಹುದು. ಅಡಾಪ್ಟ್ ಮಾಡ್ಕೊಂಡು ಯು ವಿಲ್ ಬಿ ಎ ಪಾರ್ಟ್ ಆಫ್ ದ ಸರ್ವಿಸ್. ಸೊ ಇಷ್ಟೆಲ್ಲ ಬೆನಿಫಿಟ್ಸ್ ಇದೆ.
Thank you, Dr. Ravi. Thank you so much, Dr. Basavarajendra. If you can hear me.
ಅಂಡ್ ಕಾಂಟ್ಯಾಕ್ಟ್ ಟ್ರೇಸಿಂಗ್ ಮಾಡ್ತೀವಿ, ಮನೆಯವ್ರದ್ದು ಕಾಂಟ್ಯಾಕ್ಟ್ ಟ್ರೇಸಿಂಗ್ ಮಾಡ್ತೀವಿ, ಎಜುಕೇಟ್ ಮಾಡ್ತೀವಿ, ಅವ್ರನ್ನ ಹೆಲ್ತ್ ಎಜುಕೇಶನ್ ಕೊಡ್ತೀವಿ. ಸೊ ಇದೆಲ್ಲ ಎವ್ರಿಥಿಂಗ್ ವಿಲ್ ಬಿ ಲುಕ್ಡ್ ಆಫ್ಟರ್ ಬೈ ಅಸ್, ಬಿಕಾಸ್ ಪ್ರೈವೇಟ್ ಪ್ರಾಕ್ಟಿಷನರ್ಸ್ ಆಸ್ ಅವರ್ JD ಸರ್ ಟೋಲ್ಡ್, ಡೆಫಿನೆಟ್ಲಿ ಪಬ್ಲಿಕ್ ಹೆಲ್ತ್ ಆಕ್ಷನ್ಸ್ ಮಾಡೋದಕ್ಕೆ ಪ್ರೈವೇಟ್ ಅವ್ರಿಗೆ ಕಷ್ಟ ಆಗುತ್ತೆ. ವಿ ಆರ್ ದೇರ್ ಫಾರ್ ದಟ್. ಸೊ ಆ ಬೆನಿಫಿಟ್ ಇಟ್ಸ್ ಹ್ಯೂಜ್.
Absolutely. So Dr. Basavarajendra, only a few private practitioners have joined here. So I will just, reiterate in a different way what Dr. Ravi has just explained, and he has explained it so wonderfully. So I'm not looking at the material benefits, though it is very well brought out. 500 rupees at the start of the treatment, 500 rupees at the end of the treatment. And if the private practitioner wishes to be the TB supporter also, 500 rupees, can 1,000 rupees for that also can be taken care of. But besides that, the medicines are free. The diagnosis is free. The testings is free. If you want to have the comorbidity test, you want to have any other test of the patient. And if the patient is from a humble background, imagine it is giving an opportunity to the doctor who's already God. I am not a doctor, sir, but for me, a doctor is a God who's already God, to become a godfather as well to a patient who's coming from humble background, to tell him that, your medicine will be free. Don't spend money on your testing and diagnosis. I will send you with a parchi. Go to Dr. Ravi's facility. He will do it on priority. You will not stand in line. He will do it on priority. You will not, the private practitioner will not lose the patient also. The trust and the bonhomie which is there between the patient and the practitioner will only become strong. There will be maybe some, if we start looking at active case finding, some more patients in the family who may be carrying latent TB. They can also come in the fold of the private practitioner. If the patient requires, and if he is from a humble background, 500 rupees per month into the account directly, and the private practitioner has to just enroll. Rest everything the DTO team is doing. So he is the godfather. And these are the benefits. These are the things that mean to reach the private practitioner. He will not lose the patient. he will get the free medicines at his place. He can dispense them to the patient. That's what Dr. Ravi is suggesting. So here are so many reasons that I've said, and the confidentiality of the patient will be maintained, because that is the priority. That also Dr. Ravi has brought out. And last but not the least, if the patient is from such a background, and if he gives a consent that he is looking forward to some nutritional support, this is over and above rupees 500 that he's getting into his account, what I'm going to talk. We can connect him. Dr. Ravi can connect him to a Nikshay Mitra, to a friend who could be me, who could be you, who could be the private practitioner himself, okay, who will give him nutritional support for the duration that the treatment is in progress, and counseling as well, so that he does not stop the medication. So these are the messages, sir, which, through you, which as of now we are reaching only very part of the audience. If through you it can reach, the larger audience, and I tried to bring it through Dr. Ravi, the perspective of the private practitioner, when seen through his prism. Your views, sir, Dr. Rajendra.
Yes, sir. All these things explained by Ravi also, and the place what I am sitting and all other practitioners sitting. So whatever they are giving, what we decided is, so we'll turn it to the patient itself in the way of nutrition or some other way. We are diverting that amount to the patients itself, sir, because we are not much interested on these things, even though the government is giving these things and all. So nutrition wise is the main thing, especially in our Chamarajanagar. Chamarajanagar nutrition tumba kadme ide sir. So hangagi nutrition support nam kadeinda nave kodta idೀವಿ. ಕೆಲವು ಟೈಮ್ ರವಿ ಅವರು ಕಳಿಸ್ಕೊಡ್ತಾರೆ, ದಾನಿಗಳು ಬರ್ತಾರೆ, ಬಟ್ ದೋಸ್ ಆರ್ ಆಲ್ ಸೆಕೆಂಡರೀಸ್. ನಮ್ಮ ಪೇಷಂಟ್ ಗೆ ನಾವು ಅಷ್ಟು ಮಾಡಿಲ್ಲ ಅಂತಂದ್ರೆ ಇಟ್ ಇಸ್ ನಾಟ್ ಗುಡ್ ಸರ್. ಫ್ರಮ್ ಅವರ್ ಸೈಡ್ ವಿ ಆರ್ ಡೂಯಿಂಗ್ ದಟ್ ಪಾರ್ಟ್, and whatever is the benefit we are getting, we are happy, and we are happy to join with the Ravi team and what the government TB team is doing, sir.
Thank you. Dr. Manoj, you would like to say something?
So I think this level of collaboration is phenomenal. This is how TB gets eliminated, and it is such a delight to see the private practitioners along with the government and the drug controller all together on the same page, same screen together. So congratulations.
Thank you, sir.
Devlina, over to you.
Yes, sir. Thank you so much. So now I understand that for all these benefits to the patient or to the community, all that the private practitioners and the pharmacists have to do is just a notification. It's just to notify the DTO or the NTP team. So if you have to contact the NTP team, you have the contacts over here on the screen. We have also shared the contact on the groups that are available, and the NTP team has also shared their contacts to the their pharmacists and the physicians. So here I now close this session with by thanking Dr. Ravi, and if we have we can have Shubhangi for her vote of thanks.
Yes, if there is nothing else from anybody's side, I would request any private practitioner, any pharmacist would like to ask something. Any question, you can put in the chat box. You can ask your question. You can raise your hand. We will be only delighted to clear the query.
ಯಾರಿಗಾದ್ರೂ ಪ್ರೈವೇಟ್ ಪ್ರಾಕ್ಟಿಷನರ್ಸ್ಗೆ ಅಥವಾ ಫಾರ್ಮಸಿಸ್ಟ್ಗೆ ಏನಾದರೂ ಡೌಟ್ಸ್ ಇದ್ರೆ ಅಥವಾ ಏನಾದ್ರು ಕ್ಲಾರಿಫಿಕೇಶನ್ಸ್ ಇದ್ರೆ ಇವಾಗ ಕೇಳ್ಬಿಡಿ. ಟೀಮ್ ಇದೆ, ಯಾರಾದ್ರೂ ಆನ್ಸರ್ ಮಾಡ್ತೀವಿ ನಿಮ್ಗೆ ಏನಾದ್ರು ಡೌಟ್ಸ್ ಇದ್ರೆ.
So I think Dr. Ravi, you have reached out, and Dr. Basava Rajendra has been there. Dr. Ashalata has been here. So we have all the people to take your message forward. So is there anything in your mind, Dr. Ravi, to share?
Yes, sir. Yes, definitely. I want to thank our DC sir, CEO madam, and our STO and JD sir, and even our DHO, probably because he's in a difficult terrain, he may not be able to, might not have been able to talk. and then our consultant, Dr. Shazia, and also our NTP team, and especially the private practitioners have been, very cooperative with me. Whenever I called them for sensitization programs, they have come and cooperated, and there are many gaps when we try to work together, the private and the public sector, and the government is so much ready to take forward this elimination of TB in a proper way, with spending so much of huge money and engaging them, and they have been cooperative, and I request them to continue that good support, and also from our ADC madam, she has also been cooperative. So I thank one and all, and especially the SETI team, which has taken a good initiative for us to start, because we see like this, or a session like this will boost our morale, and they also will feel the importance of them joining hands together for going to, TB Mukta Chamarajanagar, that is TB Mukta Gram Panchayat, TB Mukta Karnataka, and TB Mukta Bharat. And thank you all. Thank you very much, sir.
Thank you, Dr. Ravi. Dr. Manoj, may I request you for your closing remarks, and if you have something more in mind that you may like to share?
No, I think we've made great headway. From over the past hour, an hour and a half, we have transformed our thinking from wondering if we could do this to now determination that we can do this. And with collaboration, we most certainly can do this. So thank you. And we will be monitoring together the numbers of private practitioners who are referring, and then the positivity rate coming from there as well. And Dr. Ravi, phenomenal work in moving this agenda so much further. And you and your NTEP team are doing a great job. So thank you all.
Thank you, Dr. Manoj. May I now request Ms. Shubhangi Khare, she's a project coordinator, CAP TB project, to give the vote of thanks.
Thank you, everyone. Thank you for joining today. All the pharmacists, all our guest speakers, and all the dignitaries who have joined today, all the doctors and other institutions who have joined today. Thank you so much. Your participation encourages all of us to continue with our fight against tuberculosis disease. So I would like to thank once again Deputy Commissioner Sir, Ramesh Sir, CEO Puvita Ma'am, STO Dr. Anil Sir, WHO Consultant Shazia Ma'am, DHO Dr. Vishwesharaya Sir, Ashalata Ma'am, ADC, IMA President Dr. Basavarajendra Sir, Dr. Ravi, and the entire NTEP team. I would like to extend my special thanks to K. Dinesh Sir, Asha Ji, Vishwanath Sir, and Vikram Sir from Ashraya Hasta Trust, Bangalore. I would also like to thank our all-time supporters, Central TB Division, WHO, API, and Emory Global Health University. And lastly, our very own SETI project team, SETI admin team, IT team, and all those who have joined today. Thank you, everyone. Thank you so much.
Thank you so much, Shubhangi. With this, we close. And I extend my welcome and hello to Dr. Anand, DTO Kodagu. He's been part of our project as well. Dr. Anand, we will be coming to your district soon.
Yes, sir. Yes, sir. Thank you, sir. Thank you so much. It was nice presentation, sir.
Thank you so much. Thank you so much.
Thank you, everyone. Wonderful.
Good luck.
Thank you, Manoj Jain, sir.
Yes, yes.
Thank you. Thanks, everyone.
My pleasure. Thank you so much.
Thank you, everyone. Thank you.
TB हारेगा, Chamarajanagar जीतेगा.
Yes.
Thank
Very
you.
good.
Thank you, sir.